Fewer people are getting COVID-19 vaccines each week in North Carolina, and that's prompting health experts to warn against moving too quickly to lift restrictions.
Governor Roy Cooper does plan to do that on June 1st, only leaving the indoor mask mandate into effect. CBS 17 Capitol reporter Michael Hyland is live in Raleigh right now. And Michael, we've seen vaccinations drop a lot in the past several weeks.
Yeah, you can see here, since all adults became eligible early last month, there's been a consistent drop each week in people showing up to get vaccines. I talked to health experts who are concerned about the potential impacts in communities where people have been more resistant to getting vaccinated.
Okay, a little bit of a stick.
North Carolina is getting close to half of adults being partially vaccinated against COVID-19.
We certainly thought at this point in time that we would be a lot farther along than we are.
Dr. Dennis Taylor is head of the North Carolina Nurses Association and has been treating patients battling COVID-19 throughout the pandemic.
Are you willing to take that risk and let your guard down, particularly when you're around a lot of people that you don't know whether they've been vaccinated or not?
State Health and Human Services Secretary Dr. Mandy Cohen recently told us the goal of lifting more restrictions June 1st is in response to the state's COVID metrics improving. The indoor mask mandate will stay in effect until 2/3 of adults are at least partially vaccinated.
Most importantly, we're seeing less deaths from COVID, which is fantastic. So we are continuing to make progress, and we want to acknowledge that progress.
At the same time, state data shows vaccinations are slowing. The first week of April, more than 600,000 doses went to people, dropping to about 400,000 2 weeks later. That week, more than 2/3 of those doses were for people getting their second shots, as fewer people showed up to start the process. Dr. David Wohl at UNC says as the state lifts more restrictions, you could see sporadic outbreaks in areas where the vaccination rate is lower.
Maybe over time we'll get that immunity that we want the hard way, through people getting sick.
He hopes vaccinations will rise again.
I think some of the concerns regarding the Johnson & Johnson vaccine might have slowed things down temporarily, but I think that's been addressed.
Well, Michael, we've seen the CDC make different recommendations to people based on whether you're vaccinated. What do the experts say about whether the mandates the state puts in place should be different for vaccinated people versus those who aren't?
Yeah, Dr. Taylor at the Nurses Association says he thinks ultimately that would just be too complicated. He said he's trying to focus at this point on stressing to people the social responsibility of getting vaccinated so that there are fewer people out there capable of spreading the virus.
All right, Michael Hyland live for us tonight. Michael, thank you.